So the approval will immediately change the care, because prior to this, all we really had was avoidance for people who suffer from food allergies. And now we have another option, which isn't necessarily a cure, but it does add an extra layer of comfort and safety to the patient in making their reactions less severe. Right, so it is quite a big burden, because just in the last 2 decades, the rise of allergies and asthma in children have gone up almost 50% in terms of the prevalence, and now also they're becoming more severe as well too. And often many of the allergic conditions are interrelated, so a lot of the children's environmental allergies also trigger their asthma and their eczema, and then the same goes for their food allergies as well. So it's very important to diagnose children early and treat them appropriately. It's very critical. Parent involvement is essential, because a lot of these allergies as well as asthma-related conditions are chronic, and they require daily medication or constant vigilance in terms of watching out for reactions, whether it be food-related or skin allergies or flares of asthma or their other allergic rhinitis conditions. So parent involvement is very important, and then even more so than that, kind of the whole community involvement. So school involvement is essential, because children spend most of the time at school. Same goes for after-school activities, so coaches, teachers, anyone who interacts with a child should be aware and know what medications they're taking and how to use the medicines in case of emergencies. No, it does differ. I think the food allergies cause a lot more anxiety for parents, because many food allergies can be life-threatening. Also, it's very difficult to navigate, because it's almost, there's so many ingredients out there and so many different snacks and packaged foods, and then the parents also have the added anxiety that, you know, the child is away from them most of the day, so then they have to make sure the food that they're getting at school or camp or, you know, sports practice or on the bus isn't contaminated with the allergen. So I think that always creates an extra level of anxiety. But even environmentally, it can cause a lot of stress for parents, because often these are the things that trigger asthma, they trigger allergies, severe eczema. So, you know, both can be nerve-wracking, but I've noticed more stress with the food allergens.